You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello, I'm Dr. Rachel Hall. I'm a holistic dentist from Brisbane, Australia. This is the Dental Zone and welcome to the show. Thank you so much for joining me. I love to talk to you about how you can improve your oral health and your overall health, how the impacts of dental disease, dental issues, dental materials, that is the things that we use to restore your mouth or treat your teeth, and how they impact on your health and well-being. I love to share that information with you. And if that's something that's of interest to you, then you can hop on over to holisticdentistbrisbane.au and check out some of the blogs and articles there, or head on over to evolvedental.com.au, which is the website for my dental practice. You'll find loads of blogs and all the podcast shows on there. We also have a YouTube channel if you'd like to hop on over to that, but don't do that yet, because for now we're going to get in the zone and I'm going to talk to you about how to improve your oral and your overall health. I've been a graduated dentist now since 1992 and studying dentistry from 1987. So I've got over 35 years worth of experience within the field, and I've been practicing as a holistic dentist since 2000. And over that time, I've learned how important it is that to have a healthy body, you've got to have healthy teeth, and vice versa. They go hand in hand. They're part of the same thing. The mouth is not a separate complex. It's not something that is external to the rest of your body or just a hole that we put food in. Your mouth is part of you, and it reflects your overall health and well-being. And if your mouth is unhealthy, that will impact the rest of your body. And this is why I advocate for recommending, a natural and more healthier way of living, a simpler way of looking after ourselves, some fundamental principles that we have to apply, pillars of good health, and that for me, it's important that we use things that are natural health products that are going to enhance our oral health and overall health. And I encourage my patients to use healthy products, and therefore I do not advocate for or encourage, in fact, I discourage the use of things like fluoride, because it's a chemical, it's a poison. It's not necessary for tooth health and tooth strength. It's not a part of your tooth enamel. It has nothing to do with that. And there are other ways and better and safer ways of protecting your teeth and caring for your mouth and your gums. And so I recommend healthcare products that are going to be more natural, and they're going to help prevent gum disease, bleeding gums, bad breath, and tooth decay. But one of the biggest issues that we're facing is that the most prevalent chronic diseases affecting all men, women, and children is tooth decay and gum disease. And yet we focus on all these other aspects of healthcare, and we're not addressing root causes. We're not getting to the bottom of why people are sick. And if you've got bacteria running rampant within your mouth, you've got inflammatory disease, then that is going to be impacting on your overall health and well-being. So we've got to help people deal with their gum problems. We've got to help prevent them having gum problems and stabilize their gum health, so that we can address issues that go hand in hand with gum disease, such as heart disease, diabetes, strokes, types of cancers, dementia, and Alzheimer, for example, all linked to gum disease. And yet we're not addressing this. It's not even a missing link, but we're not even addressing this link. And so many of my dental professionals don't address gum disease properly. They do not take bleeding gums seriously. They're obsessed with the brush, floss, and don't eat sugar narrative, which, yes, it is a part of good oral hygiene, but it's not the be all and the end all, and it's only one component of it. So if you've got to have healthy gums to have a healthy mouth and have a healthy life. And this is what I'm going to talk to you about and help bring some of these pieces together. Now, I can't do that all in one episode. So again, just like my series on dental amalgam, mercury-free dentistry, metal detox, and all the other things I've covered so far in my podcast, this may run over several episodes so that I can make sure that you get the information that you need and you can help yourself to better your oral health and better your overall health, or prevent yourself having problems as you age and mature through life. I want you to have a healthy smile and a healthy life, and I want you to have a long, healthy life and a very good quality of life. So without further ado, let's get more into it. My goal is to provide you with like a self-contained dental wellness program. This is why my dental practice is called Evolve Dental Healing, because I believe if we can heal the mouth, we can help heal the body. And yeah, you go, oh, here we go. Here's another dentist talking about the cause of decay and gum disease. And it's just going to be same old, same old. Well, hopefully not. Hopefully I'm going to share with you some of the things that my patients get to hear when they're having a consultation or treatment with me. And they often comment, and look, if I had $1 for every time a patient said this to me, I wouldn't have to do dentistry. If they paid me every time they said, I never knew that. I've never heard that before. Why has no one ever told me that before? So XYZ means ABC, and they're allowed to join the dots. But this information that I'm sharing is out there. It's available in scientific literature. It's been documented. It's been well known for hundreds of years that dental disease and bodily disease are linked. Yet there's still this ignorance within us as a humanity and a community and within the dental profession about these links. And when holistic dentists start talking about them, we get derided, called quacks, and all sorts of things. But this is based on science, guys. So I'm going to bring it all together in one place for you because I want you to have optimal oral health. I'm going to talk about the causes of decay and gum disease, how to examine your own mouth so you know what's going on. I'm going to talk about what dental tools and products you need and how you can use them, the value of working with a dentist who cares about your gums or working with a dental hygienist, and how to develop an effective at-home oral hygiene program. It's really critical to understand the benefits of taking care of your gums and teeth, and it goes far beyond just what you're doing for your mouth. I mean, how many of us grew up being told, go brush your teeth or you're going to get decay, you're going to get a cavity. Go brush your teeth or the dentist is going to have to rip them out, blah, blah, blah. I'm sure there's a million platitudes that I could come up with. But we were all told you've got to brush your teeth so your teeth don't rot. Great. That's a basic premise. But what if I told you you've got to brush your teeth and keep your gums healthy because it's going to stop you getting heart disease? Had anyone told you that? You may know that because you listen to my show or you've got more interest. But if you're coming across this for the first time, then let's go into that a bit more. Let's look at this relationship of the oral and your overall health, because you can never be healthy without healthy gums and teeth. So if you can understand the benefits of caring for your mouth beyond, I've just got to brush my teeth because, I'm going to have food stuck in it, or my breath's going to be bad, or my gums might bleed, or I might get a hole and I'm going to have an extra trip and cost to go to the dentist, and you do it because you kind of resent it. Well, let's see if we can flip that around and motivate you, truly motivate you to have great oral health. Are you aware that gum disease called periodontal disease, affects 85% of the population and can have, do you realize it can have a devastating effect on your overall health? There's this long held belief that dental disease is a localized, minor disease of the teeth and gums, and that's just not correct. Dental disease may originate in the gums and teeth, but if left unchecked, left untreated, the destruction it can cause is not restricted to the mouth. There is no longer any doubt that gum disease is a very serious disease of the body. It is a systemic illness, and we know it increases the risk of heart attack by as much as 25%, increases the risk of stroke by a factor of 10. It increases your risk for respiratory disease, digestive disorders, pancreatic cancer, preterm low birth weight babies, and links now to Alzheimer's disease and dementia. Gum disease can make it more difficult to control diabetes. It is now considered a major risk factor in osteoporosis. It severely stresses the immune system, and it lowers the body's resistance to more serious diseases and illnesses. Studies on gum disease show increases in the cost of medical care. One showed that the medical costs of those with periodontal disease was 21% higher than those without it. So you can see that if you've got gum issues alone, what impacts it can have on your health and well-being. So restoring your oral health is going to improve your overall health and extend your life expectancy and the quality of your life. I'm going to say it again, gum disease is a serious infection of the body, and a little bit of blood in your sink when you spit out after brushing and flossing should not be taken lightly. That is an indication that there is something wrong with your gum health. Come on, if you washed your hands and your fingernails dripped blood, would you not be concerned? Would you not freak out? Would you not be rushing to the doctor to go, oh my gosh, my hands are bleeding, make it stop? I think you would, but why is it then that we accept if you're brushing and flossing and your mouth bleeds, it's okay? It's not. This is a sign of a serious infection of the body. Health professionals understand that the body is negatively affected by any infection, wherever that is located. Gum disease is far more destructive to your health than most infections because it does damage 24 hours a day, 7 days a week, every week of the year, and every year that you live with the condition. The more advanced forms of gum disease doesn't just involve the soft tissues around the teeth, but gum pockets as well. And this means it's affecting the membranes that hold your teeth in and the bone that holds your teeth in. Left unchecked, it's going to break through these infected pockets and it's going to enter the underlying bone of the upper and lower jaw. And the bone has extensive blood supply. The heart and the blood vessels then become continuously exposed to many virulent strains of bacteria and their toxins that are spreading from the infected bone and gums. It has been estimated that in the case of moderate to severe gum disease, the total infected area could cover the area the size of a piece of A4 paper. Can you imagine that? That you've got a whole sheet of A4 paper placed on your body and that's infected? That's almost the size of your torso. That is a significant amount of structures that are infected. Now, are you starting to see the seriousness of why, if you've got gum disease, it's so detrimental to your health? You think, oh, my mouth's just this tiny thing. But if your gums and your jaw bones are infected and inflamed, then this is a massive amount of infection. What's your reaction to this? What's your reaction? What would it be if you had an infection the size of a piece of A4 paper on any other part of your body? Say if that was your leg or your back, if your doctor saw it, they're going to consider it very serious and they're going to suggest immediate treatment. Yet, even today, with all this information that we have, most gum infections remain untreated, poorly treated, and improperly treated. The extent and severity of an infection is important, but also is its duration. Gum disease will continue to worsen every day for as long as it is present. Unfortunately, like most chronic diseases, you don't realize you have it. It's not painful, but there are warning signs. And so because it's not painful, and because your dentist isn't taking it seriously enough, this gum disease can be active for 5, 10, 15, 20 years or more. It shouldn't be difficult then to imagine the intense stress this infection places on your immune system and how it weakens your body's resistance to other far more serious diseases. Don't be fooled into thinking that gum disease will go away on its own. Don't be fooled into thinking you can swish around a bit of coconut oil and it's going to fix all your problems and it's going to go away, because it won't. That's just a fallacy. It's not true. It needs to be taken seriously and it needs proper and specific treatment. Now, I'm going to go into this in more detail. I'm going to go into how you can mitigate the effects of gum disease, how you can treat gum disease, and how you can prevent gum disease. And then if you've had gum disease and it's now being treated, how you can maintain the health of your mouth and gums to make sure it doesn't become active again. I'm going to talk about how to improve your overall health and how to increase your energy and extend your life. I'm going to make sure that you're not going to be a helpless victim of dental disease and end up with false teeth or loss of teeth. I want you to believe that improving your oral health and overall health is worth taking the small amount of time required that it actually only takes to free yourself of dental disease. And I want you to help them pass this information on to your own children and your grandchildren and other generations so that their dental experience can be better than ours or yours has been. Regardless of what you have been led to believe, there is no reason for you to suffer from gum disease, tooth decay, or tooth loss. Why? Well, it's because not only is dental disease treatable, it is very preventable. If what you've been doing hasn't worked and you want to stop your dental past from becoming your dental future, then you need to change what you're doing now, your dental present. After all, what have you got to lose? Yeah, except your teeth and your health. Let's take a new approach to oral health. Let's look at a different way. I'm going to try and make everything as simple as possible. I'm going to try and make it enjoyable, even though at the moment I may seem a bit intense and in rant mode. But this is because I am so frustrated with the given upness and the attitude of, oh, well, you get gum disease, there's nothing you can do about it. It's not like that. My purpose is to raise your dental awareness and to motivate you to stop being a victim of dental disease. It's the thing that really bothers me, though, is this attitude of, I come to the dentist every 6 months and the dentist should fix my problems and stop me having problems. And then when I come back and you have to tell me I've got decay only 6 months after my last checkup, it's your fault, doctor. You must have missed something. I was only here 6 months ago. How can I possibly have gum disease again? How can I possibly have another cavity? Well, what are you doing in the other hours and days of the year when you're not at the dentist? What, you spend 40 minutes twice a year in my office and that's supposed to fix everything? What are you doing in the interim? That's like saying I see a personal trainer twice a year and I'm still unfit, overweight and unhealthy. It's the personal trainer's fault. No, it's what you're doing day in, day out that causes your issues. But therefore, it's what you're doing day in, day out that can prevent and fix your issues. That's the good news. Preventing disease is something that you have to do. It isn't the same as treating it. So don't expect me as your dentist or the dental hygienist to do it for you. You have got to do it for yourself. This doesn't mean that we don't work together as a team. You know, the way I see it, as your dental professional, I'm part of your wellness team. It's my job to help support, guide, and monitor you through the process and to treat what needs to be treated when you present to see me. It's not my job to prevent the problem. It's my job to help you understand what the problem is and how to prevent it yourself. But remember, it's up to you. If you don't have to take care of your teeth, but, love them or lose them. Only look after the ones you want to keep, which I would hope would be all of them. So we're going to go through, just very briefly here in this show today, the 6 steps to oral health. I think there are 6 key steps that you must take to ensure that you've got dental health, that we can do dental healing and you can have a good at-home dental wellness program. So step 1, little bit of a self-plug, tune into the shows, tune into the episodes. If you truly want to eliminate gum disease and improve your oral health, you must really get all the information that you need. So I want you to come back to the next episodes and we're going to take this deeper. Don't worry, I'm going to pitch this for you as patients, not about dentists. It's going to be easy to listen to, easy to take in. And I reckon actually my dental colleagues should actually tune in. They might start going, the penny's just dropped. We've got to do more for our patients than just clean their teeth. We don't clean your teeth. We are treating disease. I hate saying, you're here for your tooth clean. I'm just getting a cleaning. No, we've got to change that around. You are getting treatment for disease. You are getting preventative care to prevent disease. We are maintaining the health of your mouth, teeth, and gums. Okay, it doesn't matter how much you know about this subject. Hopefully by the time you've listened to the shows, you'll have all the information you need to free yourself from gum disease and tooth decay forever. I know that's a strong claim, but I sit here with no gum disease and no tooth decay. I see patients with no gum disease and no tooth decay. It is possible, guys. No matter what you've believed, what you've been told, if you think that it's enough just to go to the dentist twice a year and have your teeth cleaned and damage repaired, then I want to change that paradigm. I want to change that way of thinking. The truth is, dental treatment does not prevent dental disease. I'm treating disease, guys. You must be willing to commit to establishing an effective overall oral hygiene care program. No need to feel bad about what has and hasn't been. Don't feel, I've had terrible teeth all my life and nothing's going to change, and I'm such a bad person or anything like that, or that you're a failure. Just drop that narrative now, because falling into that judgmental trap's not good for your health and well-being. Make today the first day of your new dental life. Make the conscious choice that you're no longer going to be a dental victim, and I'm going to support you in your journey to dental health. So that's step 1. Gratuitous plug, listen to the show, because I'm going to give you the information that you need. Step 2, find a dentist and a dental hygienist. If you don't see a dentist on a regular basis, you absolutely need to find one who's going to support you in your efforts to eliminate gum disease and tooth decay. You will need the dentist to diagnose and treat the existing damage to your teeth and gums, and then you'll need that dentist or their dental hygienist to help you design a personal oral hygiene program. I believe that both are absolutely necessary to achieve optimal oral health and improve your overall health and well-being. Step 3, make a connection with your dentist and the dental hygienist. Studies have proven that a wellness program will be more successful if it's monitored and supported, and I agree completely. We need to help you know exactly what's going on, exactly where in the mouth any problems are, where there's any residual disease, where there's been the most damage, and how you can support yourself. And then we give you feedback on how well you're doing. We've got to measure what's going on so that we know exactly how to deal with it. I'm going to provide you with the valuable and the necessary information. You can, I want you to be able to have your questions answered. I want you to be able to fine-tune your hygiene program or the way you clean your teeth. I can't personally do that for everybody. I can't be there to be your cheerleader, pat you on the back and make sure that you're doing the right things. But a good dentist or dental hygienist, that is going to support you in your program, and then we will act in that capacity as your support team and your cheerleader. When you're doing well, we're going to let you know, and we're going to encourage you. Where there's areas for improvement, we're going to point that out. I'm going to explain how to effectively work with your dentist or the dental hygienist so that they can customize the program that I'm going to recommend to fit your unique dental needs. And then we want that person to enthusiastically look after you. We want them to monitor and guide you and cheer on your efforts. I don't want you to be with someone who's constantly going, you're not brushing properly, you're not flossing good enough, you got to floss more, you got to brush more, but they don't tell you how, what, or why. That makes no sense. Step number 4, you may not even know what it is, but I'm going to explain it. You've got to utilize a periodontal pocket chart. Now, if you've never had a periodontal chart done, where the hygienist and the dentist has taken the time to insert a little measuring instrument around several points on every tooth and call out numbers that measure the level of disease, document bleeding, infection, and inflammation, then your gum disease is being ignored. It is not being taken seriously, and it is certainly not being treated properly. The periodontal pocket chart will show where gum disease is located and the severity of the infection in those areas. With this knowledge, you'll see which areas to focus your energy on, where to spend your most time and effort, and what are going to be the best preventive tools to use. Then we can use those periodontal charts over time, where we remeasure to document progress, to check on the state and the health of your mouth, to see if there are fluctuations in your disease, to see if there are areas of improvement, to see if there are areas that are holding stable, or to see if we've got areas that are not coming under control. And then we can change tack and change tactics to be able to better maintain and deal with those areas. So if you've never had a periodontal chart done, you're with the wrong dentist, because I think it is disgraceful how many patients I see for the first time, and we measure their gum health, and no matter their age, they could be in their 20s, they could be in their 70s, and they've never had it done. That is a crime against your health and well-being. But we are not, as a profession, invested in taking 5 minutes of our time during your appointment to take measurements that indicate the level of your disease. How would you feel if you went to your doctor and they did not listen to your heart, take your blood pressure, listen to your lungs, do any tests, or send you for any tests? What would you think about that doctor if they just took one look at you and went, oh, everything looks okay? Or if they said to you, oh, you're a bit swollen and red, and when I press on you, you bleed easily, but don't worry about it, just brush and floss. You'd think they were freaking nuts. You would not recommend that doctor to your friends. I went to that doctor and they did no tests. I went there and I wasn't feeling well and they did no tests and they told me everything was fine. But your dentist does that. If your dentist is not at least once a year measuring your pocket depths, they are not diagnosing and checking for disease, and they are leaving you with infections of a very serious nature. All my new patients get pocket measurements done. My patients get a spot check pocket measurement done at every single hygiene appointment. We annually record whole mouth pocket depths for every single patient. My patients who are at higher risk of gum disease, who've had a history of gum disease, we will do those pocket measurements more frequently. This is how seriously we take it. I don't just sit there and go, oh, your gums are a bit red. Oh, they bleed. Don't worry about it. Just brush more. No, we hammer home this message. Are you getting how serious this is? So, step 5, you're going to write down your questions for your dentist or your hygienist. I'm going to encourage you to listen to the series of shows before you go for your next oral hygiene appointment. Write down any questions you have so you don't forget them and take them with you to the dental office. Don't feel embarrassed about doing this. We are trained to support you with your efforts, and that includes answering your questions. Just get a small notebook or make a notes thing on your phone and you can keep track of your questions, and then you've got somewhere to write down your answers. Remember, as your dentist, I don't have a crystal ball. I can't read your mind. I don't know what your thoughts are. I don't know what your questions are. So you actually need to communicate with me and ask me those questions. I will always start, hey, how you going? How's life? How's things? Any concerns with your mouth, teeth and gums? Pretty much every visit, my patients know that's how I'm going to speak to them. Have you got any concerns with your mouth, teeth and gums? Is there anything you want to tell me, or is there anything you need to ask me today? When we're finished, does that make sense to you? Is that all clear? Do you have any questions? My job is to help you have better oral health and have a healthier life. Ask the questions. Then number 6, we're going to come up with a personal dental health and wellness program. Once you've got all the information and you've had your oral exam and you've had your teeth cleaned, you've asked your questions and you've had them answered, you'll have taken a really big step towards having optimal oral health. With this information and the support of your hygienist and your dentist and your personal efforts, it won't be long before not only will you be free of gum disease and tooth decay, but you've got your personalised prevention program that's going to fit your situation. The rest is up to you. Ultimately, the success of your oral health and dental health program is in your hands. Together with the information that I'm going to share, you'll be able to make the educated choice, and that is the choice of choosing health over disease. You'll be empowered to take control of your oral health, and you'll stop being the victim of this chronic, insidious, and health-destroying disease. You'll have the satisfaction that you've reduced a risk factor for far more serious diseases, as well as improving your oral health. So I'm going to bring you a new awareness of understanding your mouth and your relationship to your oral health. I encourage you to come back and listen to more shows, and I want to make it worth your while and make it positive and make it something that you will take on board and you will share with your family and your friends, and we will get this message out there. So over the series of next shows in the Dental Zone, I'm going to be talking about the truth about tooth decay. I'm going to talk about the inside story, how decay happens, and the susceptible areas. Then I will do a show on gum disease, the causes of periodontal disease, how it's classified, and how we start to treat that. Then I'm going to do another show on oral self-examination, what you need to look for, how you can check your own mouth so you've got a better understanding of what's going on. I will talk about the tools of your trade, what you need to be able to look after your mouth. We'll go into the personal home care program, so all about brushing, how to brush, what techniques you should and shouldn't use, whether you should floss, what you should use to clean in between your teeth, mouth rinses, tongue cleaning, all sorts of things like that. And then I'll also go into how to work with your dentist and your dental hygienist. So go back, listen to what the 6 steps are, understand the importance of gum disease, understand that it is a serious systemic infection that is causing inflammation and damage to a part of your body that is the size of a sheet of A4 paper. And we should be beginning to take this very seriously. That if your dentist isn't doing the pocket measurements that I've talked about, you're going to ask them, why not? You're going to ask them to start measuring them. But if they're not measuring them, then that says to me they don't take gum disease seriously. And maybe that's not the right dentist for you if you're committed to having the best dental health. I'm Dr. Rachel Hall. This is the Dental Zone. Thank you for joining me into this introduction on how to improve your oral and overall health. I hope that you've started to have a little bit of an aha moment with this and that it's started to pique your interest and get you ready for what's to come in the next several shows so that you can have all this information and be empowered. If you'd like to know more, 2 places you can go, holisticdentistry.au or evolvedental.com.au. There's far more stuff on gum disease and overall systemic health on the evolvedental.com.au site. If you want to come and see me for a consultation to talk about your dental health, any dental concerns, and you're in the Brisbane area or you can travel to Brisbane, then the number to call to book an appointment is 07 3720 1811. Thank you so much for joining me, and until next time, stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.